Today I want to talk to you about a very common problem that can affect your health without you even realizing it. Poor diet quality and how it can impact your cholesterol, blood sugar, weight, digestion, and even your daily energy. Most importantly, I want to show you how a simple food like rolled oats can help improve all of this without needing so many medications. Today, I'm going to explain how it works, why it's so beneficial, and how you can use it to support the health of your heart, arteries, and metabolism. I say this as a doctor and as someone who has seen these changes in many patients. A few months ago, I treated Mrs. Mercedes, a 67-year-old woman with high cholesterol, elevated blood sugar, and significant inflammation. She started including rolled oats several times a week, and together with other lifestyle adjustments, her energy improved, her digestion became regular, and her lab results changed for the better. The same can happen to you if you make small, sustainable changes. I'm Dr. Gabriel Mena, and I welcome you to my channel. Here we talk about holistic health, longevity, and simple, natural habits that help you maintain physical, mental, and emotional balance. So take notes, share this with your family and friends, and help them improve their health. We upload new videos every day, so make sure to subscribe and activate the notification bell to get all updates. Before we continue, if you find this content valuable, a simple gesture like supporting the video or sharing it helps this message reach more people who need it. Thank you sincerely for being here and caring for your health. Now, let's dive into the topic. Before we begin, I invite you to subscribe to this channel, share the video, and activate the bell, because every day we upload practical information that can help you naturally improve your health. This channel is designed especially for you. Today, I'm going to introduce a food that many consider almost like a natural medicine. I'm talking about rolled oats, not just any oats, but whole oats, with certain qualities we'll discuss later. I want to start by explaining something important. Studies in scientific nutrition journals show that oats and their components have effects very similar to some medications, but without side effects and at a much lower cost. It has been documented that oats help reduce cholesterol, lower blood sugar levels, and improve immune response in people with allergies. Additionally, oats have antioxidant, anti-cancer, and anti-atherogenic properties, meaning they help prevent fat accumulation in the arteries. Think about this. What medicine does so many things at once? Oats can help with cholesterol, blood sugar, inflammation, weight, asthma, and even improve skin health when used topically. That's why I say that after seeing what this food can do, it's hard to recommend miracle products or pills without scientific backing. I don't sell supplements. I teach how to use real foods that actually work. Let's rely on evidence. The scientific literature is clear. When you consume rolled oats regularly, your body receives both soluble and insoluble fiber, which acts from the stomach to the intestine. Soluble fiber forms a natural gel that coats the stomach lining and slows gastric emptying. This gives you a longer-lasting feeling of fullness, prevents sugar spikes, and helps control weight. That satisfying feeling isn't a coincidence. It's your digestive system responding in a healthy way. When this fiber reaches the intestine, it feeds your microbiota, the community of good bacteria that play a key role in your health. Also, because carbohydrates are absorbed more slowly, glucose doesn't spike, and the pancreas doesn't have to release large amounts of insulin. This reduces cravings and protects your organs over time. I want to make one thing very clear. These benefits occur with whole rolled oats, not refined cereals or ultra-processed products. Many people say cereals are bad for diabetics, but that only applies when the products are processed. Natural oats work differently because their fibers, nutrients, and metabolic benefits remain intact. Another important point is fermentation in the gut. Part of the oat isn't absorbed immediately. Instead, it nourishes good bacteria and promotes the production of substances that help reduce inflammation, improve insulin sensitivity, and limit fat storage. Even for the liver, oats play a central role. I've had patients who were shocked because they woke up with blood sugar at 200 or 300 despite fasting overnight. What happens is that the liver releases glucose before you wake up to give you energy to start the day. Oats help regulate this process, keeping morning glucose levels more stable. For those with fatty liver, oats are also an ally because they lower triglycerides and improve metabolic response. That's why, in medical guidance, I always recommend starting with lifestyle changes before adding more medication. One of those changes is incorporating high-quality oats into your diet. Here's an important tip: try to use organic oats. Conventional oats are often dried with substances like glyphosate, which speeds up production but can affect your health. Organic oats are dried naturally, take longer, cost a bit more, but are a much safer choice. Oats also help improve circulation because they reduce blood fat. They're a complete tool for anyone needing to regulate cholesterol, glucose, inflammation, and weight. Soon, I'll show you how to prepare them and how to take full advantage of all these benefits. We'll continue in the next section. If you're someone who tries oats and notices your glucose rises, I want to explain carefully why this happens, because it has a solution. Oats are not harmful to your arteries, heart, or metabolism. The real issue is the condition of your body on the inside. When the liver and muscles are full of fat due to years of poor diet, the body struggles even with healthy foods. This is something I see daily in my practice. I once treated Mr. Ricardo, a 64-year-old man who complained that anything he ate spiked his blood sugar. He told me, "Doctor, even oats raise my sugar." When we reviewed his case, his liver was so loaded with fat that his body couldn't process even slow-digesting carbohydrates. Once he started clearing that excess fat with simple changes, oats stopped raising his glucose and began helping him. I mention this because you, or someone close to you, may be in the same situation. I always make this clear: the problem isn't the oats. The problem is that many patients come with the advice to eat a little of everything, which doesn't work when the body is saturated with sugar and hidden fat. Think about how your body works. You have your liver, muscles, and pancreas producing insulin. When you eat rolled oats, glucose enters the bloodstream slowly, and the pancreas releases just enough insulin to allow glucose to enter the cells and be converted into energy. If a person is healthy, with good muscle mass, exercises, and doesn't have diabetes, fatty liver, or high triglycerides, oats are processed without problem. 2 hours later, glucose levels stay between 70 and 100. But if someone has diabetes, hypertension, high cholesterol, elevated triglycerides, fatty liver, or excess fat in muscles, the story changes completely. With these conditions, any carbohydrate, even slow-digesting ones, will raise glucose. It's important to understand where all that fat comes from. No one is born with fat in the liver or muscles. It accumulates from excess added sugars over the years. For example, in a typical breakfast, some people consume around 118 grams of sugar. The body can only handle about 25 grams per day. That excess 93 grams is converted into fat, which is stored in the liver and muscles. That's why, in someone with this condition, oats can raise glucose. They simply can't process it yet. I always say, if oats raise your glucose, don't blame the oats. Blame prior habits and, often, advice that told you to eat a little of everything without first correcting insulin resistance and fat accumulation. When a person is healthy, oats help. When a person is metabolically unwell, the issue is the body's current state, not the oats. Some people ask if instant oats are good. They aren't, because they usually contain added sugars. What we need is rolled oats, unprocessed, whole, preferably organic. Others ask if oats can be blended in smoothies. I always recommend eating them in their original form because blending changes their structure and accelerates absorption. It's the same as eating whole fruit versus drinking juice. One is a real food, the other is ultra-processed. Overnight oats, prepared by letting them soak so resistant starch forms, are an excellent option. This method helps your intestines work better, reduces inflammation, and prevents glucose spikes. If you have thyroid issues, fatty liver, or even if you no longer have a gallbladder, you can consume them safely. For many groups of patients, oats are both safe and beneficial. Scientific studies are very clear on this. Oats and their compounds have powerful effects. They lower cholesterol, reduce blood sugar, regulate inflammation, protect the heart, help with asthma, improve skin when used topically, and support weight management. When you add foods like ground flaxseed, you increase fiber even more, improving digestion and blood pressure. Recent studies even show that oats form a gel in the stomach that slows gastric emptying. This prolongs satiety, regulates appetite, and helps avoid those mid-morning hunger spikes. That's why many people who start eating oats feel they can control their meals better without experiencing cravings. In another study, oats were shown to reduce abdominal fat and improve liver function, which is key for people with fatty liver. They also lower triglycerides, improve insulin sensitivity, and promote a healthier gut microbiota. When the microbiota improves, your body responds much more steadily. To prepare them correctly, you only need organic rolled oats, ideally with almond milk or hot water. Cook them for about 15 minutes until they thicken, store in the fridge, and the next day enjoy with green apple, berries, nuts, and 1 or 2 tablespoons of ground flaxseed. It's a breakfast that works better than multiple pills combined. Many patients think oats cause discomfort if they have gastritis, but the natural gel they form acts as a protective layer in the stomach. It's very similar to the relief some antacids provide, but naturally. If you're worried about finding organic oats, most supermarkets clearly label them. It's important to choose rolled oats, not crushed or overly refined. Real oats look like small flakes. This is the kind that preserves all its natural benefits. Some people believe oats are not good for insulin resistance. Scientific evidence says the opposite. What happens is that when the body is metabolically compromised, any food can become difficult to manage. The solution is to heal the metabolism, not eliminate oats. When used correctly, oats can help cleanse the gallbladder, improve fat digestion, and reduce liver fat. I would never recommend miracle pills on social media when I know such a simple food can provide so many benefits. There are online contents that have even used my image with artificial intelligence to promote products I would never endorse. But here, I speak clearly. This food can help stabilize blood sugar, cholesterol, triglycerides, blood pressure, inflammation, and weight. That is what I want you to understand. In the next section, I'll explain more about how to maximize these effects and which combinations work best for each need. Are you worried that your glucose rises even with healthy foods like oats? Today we're going to solve that problem, and I'll show you how to consume oats without affecting your blood sugar while supporting liver health and metabolic well-being. Look at this study published in the journal Metabolism and Nutrition. It clearly shows how oats help lower insulin. The reason is that when we incorporate healthy fats into breakfast, the liver doesn't resist processing glucose as much. If eating oats raises your blood sugar, it's a signal that your liver or muscles have excess fat from years of poor eating habits. And if even fruit raises your glucose, imagine processed foods. Some people ask me, "Doctor, if I don't have a gallbladder, can I eat oats?" The answer is yes, absolutely. Oats support your gut microbiota and aid digestion, even if you have mild digestive issues. Another common question is, does cooking oats reduce their benefits? No, in fact, cooking can enhance their properties. Here's a real-life case. My mother, who is 84, had a glucose crisis of 500 a few months ago and had to be hospitalized. Since then, I adjusted her diet with oats, nuts, flaxseed, and protein powder. Today, she doesn't need insulin or medications and maintains normal glucose levels. This demonstrates that oats can be an incredible ally when consumed properly. Regarding quantities, for breakfast I usually use about 100 grams of oats with lemongrass tea or unsweetened almond milk, and add green apple, organic cinnamon, and berries. Sometimes I let the oats soak overnight to reduce gas and enhance resistant starch, which feeds the microbiota and improves intestinal and metabolic function. You can also add nuts, flaxseed, or a bit of protein powder. Oats can be paired with plant-based milk, like almond or soy, but not coconut or cow's milk every day, as these can raise glucose. For those with gallstones or type 2 diabetes, oats remain safe, but it's ideal to adjust the portion with your nutritionist. They can even be complemented with diluted apple cider vinegar, which won't cause irritation if consumed properly. Studies show that consuming whole grains like oats reduces the risk of developing non-alcoholic fatty liver and improves liver health. In contrast, refined grains, white bread, and refined flour increase the risk. Whole oats provide protein and satiety, and you can alternate them with lentils or legumes at dinner, filling yourself up to about 80% to sleep well. Now, I warmly invite you to join our community, subscribe to the channel, activate the notification bell, Share your experiences in the comments, and share this content with someone who needs to improve their health. Every day we upload new videos with practical, easy-to-implement tips, designed especially for you. Thank you for being here, learning, and taking care of your life. Before we finish, let's pause to reflect and give thanks to God. Thank you, Lord, for allowing us to learn, improve our health, and receive the opportunity each day to live better. Guide us to use this knowledge and share it with love with those around us. I want to remind you that our mission goes beyond food. It's about transforming lives. Every night, when I prepare my reflective dessert, I think about how God has changed my heart and how I can share that light with others. Just as my mother regained her health through simple, consistent changes, you can too, and teach others the way. Tomorrow, we continue with a fascinating topic, quinoa. My nutritionist will show us how to prepare it, and at the end, we'll have a special segment on men's health, focusing on prostate cancer prevention. Don't miss it. I'll see you at 8 p.m. Remember that on Dr. Gabriel Mena's channel, we are happy to contribute to your well-being, improve your habits, and provide practical information you can actually apply. There will be a new video tomorrow, and I want you to watch it so we can continue learning together. Thank you for trusting us, subscribing, sharing, and allowing us to be part of your journey toward a healthier life.